Hi there, I'm Ed Thompson. I'm the founder of Instant Physio, and thanks for checking out our website today. There's a good chance that you're on the website because you're struggling with something like knee pain, back pain, neck and shoulder pain, or maybe a sports injury or something else, which is causing you to maybe be a little bit worried about what's the best solution for you. And I'm going to talk you through some of the options that you've got available, and also tell you a little bit about how we like to help people as well. A lot of the time people, before they come in to see us, they are feeling a little bit stuck. Maybe they're feeling a little bit worried about their symptoms, and they're concerned that the problem that they've got is stopping them from doing something they really like to be able to do, whether that's playing with their kids, or playing or spending time with family and friends, or maybe even being active and doing something like running or playing sport, or just being able to keep active and stay healthy. And a lot of the time people try other solutions first, things like Googling their symptoms, or trying braces, or trying various things off the internet. Maybe they try some treatment elsewhere, things like massage or acupuncture, and maybe don't quite get the results, and they don't quite get to a point where they feel like they're confident to get back to what they like to be able to do. And maybe sometimes their family or friends are starting to notice they're moving a bit differently, things like, they might be limping or something like that, or even it might be starting to affect their sleep, which is really, really common as well with some of our patients, and that starts to impact on your mood, and again it starts to cause this ripple effect, which can start to become a real problem and a real frustration for a lot of our patients. I'm just going to show you through to the rehab space that we've got as well, and a lot of the time the thing that we do a little bit differently to most clinics is, along with understanding the diagnosis, as in what we want to do on the first session when we see you is understand the specific tissue which is causing the pain, which is the diagnosis, and really get an understanding of the workings of your injury. We also want to spend a lot of time on analysing the root cause as well, which is where a lot of the time people haven't had a specific trauma or a specific injury, and it's just something that's crept up over time, and they don't quite understand why that's happened. And that's what we spend a lot of time on the first session, understanding and identifying, so that we know how to treat it and how for it to help stop it coming back as well. And the way we do that is by looking at the joints above and below, and looking at the rest of the body as well, so that we know how they're moving and how that's contributing to that part of the body working too hard as well. Other times we look at people's training programs if they are into exercise, and other lifestyle factors are really, really important as well, so that we can understand why this injury is there in the first place. This is the gym. This is where we do rehabilitation with our patients when they're ready. What we normally start off with is things like hands-on treatment and taping to help people get back to feeling their normal selves and get them back to feeling more confident, and maybe even they might have some joint stiffness as well, and hands-on treatment can help a lot with that. And once they're ready, that's when we might introduce things like rehabilitation and corrective exercise, which is really, really good at treating the root cause of the problem and getting someone moving better and getting back to what we call thoughtless, fearless movement, where you're moving without thinking about it. And that's, for example, where someone with a shoulder problem, before they go to grab something, they might have to think about before they do it, and that's a very top-down approach where you're very mechanical in how you're moving. And what we spend all of our time treating people doing is treating them to get them back to being at that sort of more bottom-up approach, where the hand and the arm are deciding what they're doing before any conscious thought is involved. But again, when you're worried, when you're concerned about an injury, it's the opposite. You're very mechanical and careful about how you do things, and it becomes very unnatural. And sometimes when you actually think how long you're spending thinking about that injury, it starts to become, you start to realize how big an impact it's having on your life. So there's a few different options that you can choose from on the website. There's lots of free information that you can download